Hi, my name is Bryan Rogoff, and I am an industry consultant for both corporate and for private practice in the ophthalmic industry. I'd like to discuss a little bit about the dynamic changes that have been going on, especially as healthcare reform has started and the economy has really taken a beating, and we're seeing a lot of consolidation in the industry and also amongst practices. A lot of my clientele seems to have a lot of difficulties and challenges more or less with the healthcare reform and also the business side. Practitioners are just not able to just handle clinical sides anymore. They have to handle both a lot of employee issues, they have to handle a lot of practice management issues, a lot of business issues, and now a lot of healthcare reform that is intruding in on a lot of patient care. It's extremely important for both practitioners and practice managers as well as industry to realize that these changes affect everybody and it all rotates around each other. A lot of things that I talk about when I do a lot of business and practice consulting is talk about marketing and social media and how important role that plays. A lot of corporate retail places that are consolidating, and there's a lot more competition. Advertising and the way people come to your practice is much different. A lot of things also that are on a lot of practitioners' minds is a lot of business when it comes to lowering your financial risks. There are lots of new avenues to generate revenue, and it's very important to be smart about how you handle your money and how you invest in your practice. A lot of times you can have a lot of salespeople from industry indicating how one practice is utilizing certain tools and a lot of different instrumentation to bring up revenues in their offices. These may not be the same answers for your practice. A lot of things depend upon a lot of other things such as your demographics, how your patients are being brought to you, and just typically how other parts of the industry such as ophthalmology is treating patients around you. Another thing also is making sure your practice is efficient. With times of healthcare change, it's extremely important that we're not only efficient in how we're handling things in the office, but also how things we're doing in the exam lane. With healthcare reform and reimbursement rates much lower, it's extremely important to develop your staff and also to make sure that they have certain incentives to make sure that they are doing their best to not only maintain your patients, but also to make sure they're maximizing the profits. And some other pieces that I'll be talking about in some later issues is how to handle your no-shows, how to build your practice, also how to make things more efficient, cross-training, development, how to invest and how to set up rainy day funds, and especially when you start to look at other pieces of equipment, if it's smart to finance or is it smart to also lease, depending on different aspects of your practice. A lot of the healthcare reform that's going on now is affecting things directly to you, such as ICD-10, which EMR systems you should be going with, what systems will be effective, should you be getting into an ACO if your state allows it, and how optometry can gain access into that. A lot of the reform that is going on also, as I participate with the AOA on the advocacy accounts, is also how to get optometry to get paid for healthcare services along in Medicaid as well as the vision care services. We already have that in Medicare, but Medicaid is a very big issue as that's starting to expand with the ACA. These are all things that can improve upon your business and also gain more patients into your chair. And it's important to be efficient and also to think about these three different dimensions when you're practicing, not just about the clinical side. Thank you again.